Any hospital or healthcare system is both complex and complicated. By complex, that means that the problems aren't simple and you just can't put protocols in place to fix everything. By complicated, it means that they are difficult. When we first heard about Care Logistics and heard about the way that they approach work in helping to improve the operations and reduce the complexity and complication that's seen in hospitals and health systems, it was very exciting.
So before Care Logistics, all of our departments were really operating in silos of excellence. Everyone was working hard to improve patient throughput and flow, but there was a lack of coordination between the various departments, which often resulted in patient delays and white space.
Patients were here for a very long time, doing a test one day, then a test the next day. So we were holding in the emergency department a lot longer. Care Logistics operational model works for us because we see the patients as they're coming in from all different areas of the organization. Now there are beds open to place these patients in. We were able to move patients quicker and safer.
The Care Logistics technology allows us to run a very efficient centralized hub, and this is sort of an air traffic control, and we are able to see the patient flow throughout our entire health system from a centralized location.
We've been able to achieve a dramatic reduction in our observed to expected length of stay over the past 18 months since we went live with Care Logistics.
Care Logistics has helped remove barriers from patient flow by having everything visible. We're able to see everything the patient is here for, what kind of testing the patient is here for, and the team in the hub work together to ensure that's done in a timely manner.
The Care Logistics platform works in concert with our other technology platforms, including our electronic health record. This allows us to maximize the value of those investments that we've made from a technology standpoint and also execute on highly efficient and high quality patient care.
Operational rounding has been another big part of our Care Logistics relationship, and it's probably my favorite part.
It allows our executive and senior leaders to visit our frontline departments on a bi-weekly basis to hear about the great work that the departments are doing, but it also allows our senior leaders to hear the struggles and the barriers and the opportunities that our frontline staff are facing that otherwise may not have ever made it up to that executive senior level.
Operational rounding is extremely valuable in our organization, and I think it has empowered our frontline leaders and our frontline staff in ways that we never even imagined.
I like anything that brings us together in the organization. Essentially, I'm a finance person, not a clinical person, but it's really great when we can bring clinical leadership and other folks together to solve problems. During 2022, many hospital systems really struggled around labor and manpower, that there was an acute shortage of nursing. At the same time, we saw a spike in inpatient COVID cases and fell into deep multi-million-dollar operating losses every month. At about the same time, we were really sort of hitting our stride with the Care Logistics tools and getting much more focused around efficiency and really bringing down length of stay. And by the end of the second quarter in 2022, we started to make money again. So, Care Logistics was a really important component to our ability to pull ourselves out of that kind of tailspin and to go back into profitability.
Efforts like we've done with Care Logistics that really help us become more efficient and more effective help us also to remain independent. It allows us to continue to be a sustainable, thriving healthcare system that doesn't need a big partner necessarily to continue to thrive right here in the middle of Virginia.
Part of the Care Logistics model was really ingraining continuous performance improvement continuously into our standard operations. That ground up, grassroots, continuous performance improvement at every single unit level has just been a game changer here, both culturally and performance-wise for our health system.
The way I sort of explain it is Care Logistics gave us the recipe, but they also gave us the top chef to come along with the recipe to show us actually how to make the recipe.
In Care Logistics, what we have found are true partners helping us improve the health of our community.